In the last week, the major rheumatology conference, EULAR, was meant to be held in Frankfurt in Germany. But of course, due to the pandemic, it has moved to a virtual conference, and many of us around the world have been logging in to watch it online. Now, all of us have been watching for the last few weeks in a lot of interest to see whether our patients with rheumatic diseases are at more risk of COVID-19 infection and the problems that occur once they have infections. The good news is that after around 7 million cases of COVID-19 around the world, there is not any signal that patients on disease-modifying agents are at more risk of COVID-19. This is true for the patients that use the doses in rheumatology. And that's both for the conventional DMARDs like methotrexate, cilazopirin, Arava, and Plaquenil, as well as the specialized DMARDs such as the biologic agents that we inject and the JAK inhibitors, the new potent oral agents that we use. Now, this is really good news. I think it's still a space we will watch carefully, but for now, it continues to give us assurance that our patients with rheumatic diseases should continue on their medications. To be safe in the event of actually catching COVID-19, the suggestion would be to stop these DMARDs until the person recovers from the infection. As an aside, and a general rule of thumb, we also want to keep using as little prednisone as we can. And the preference would be to use stable doses of DMARDs to enable this to happen. So this is overall good news. I would still encourage all patients on DMARDs to at least touch base with their treating rheumatologists so that they can tailor this advice for their particular circumstance. So please keep well, keep safe during these times.